Yeah. So once more, welcome. Thank you so much to our 5 panelists today, our graduates of Barnard College. Of course, thank you so much for making the time to join us today. My name is Jihyun Ju. I'm the advisor and program coordinator here at Beyond Barnard. And I'm joined here by the Director of Advising and Programs, Amanda Dye, who will, she'll be moderating our event today. And there will be an audience Q&A toward the end of our program. So feel free to ask questions either in the chat, or when the time is right, please feel free to unmute yourselves as well. So Amanda, I'm going to pass it off to you.
Okay, great. Thank you, Jihyun. Thank you so much to our wonderful panelists. I'm really excited to get to meet you all and to talk with you all today about issues of gender and intersections with healthcare. This is definitely a topic that is really on the minds of many people. There are discussions at the forefront of current events, and these are also questions that are really important to many of us as citizens in the bodies and identities that we inhabit. So I'm really grateful, and thank you all so much for being with us for this discussion. With Career Insights, we always start off with introductions, and we are not super formal around here. So anybody who wants to go first can go first. I would love if each of our panelists can introduce themselves and tell us a little bit about your current roles and how you got there. Tess, you're next to me on the screen. You want to go first? Oh, sorry.
I can start. Sure. So I'm Sabina Neem. I am a psychotherapist in private practice. I just, about myself, I'll say that I'm the child of Indian immigrants. I'm the only US born member of my family. How I got to Barnard is kind of like a little bit of magic, I think, and I'm really grateful. My father was a merchant marine and captain in the merchant marine, so college in the US wasn't something that you had to navigate. I'm a little nervous. How I became a psychotherapist in private practice. Well, I think I worked in student development at the Office of Multicultural Affairs at Seattle University. And there, what I noticed is that students get a lot of strengths finder advice. And in some ways, I'm glad I didn't get that, because I did a lot of different things that were more about my interest and calling and exploration and not knowing, and led me a lot of different directions that are in in my introduction profile. But I think I moved into private practice to also think about myself as part of what I think is important for me to talk about today, is liberation, and that my personal liberation and collective liberation are connected. And I wanted to have a way to, as a queer woman of color, support myself. And for me to not work in systems that are steeped in white supremacy, that were making it hard for me to find joy. So I started my own practice. And in terms of the work I do now, I see mostly adult patients. They find me mostly through word of mouth, and are living on the margins in different ways. And I see a phase 2 of my practice. I have a 3-year-old right now, so that's kind of narrowed my work kind of public facing. But I think as I see, I feel like there will be a light at the end of the tunnel where I'll have somebody who's not hanging on me in the same way. I'm hoping to really expand my business into more of the looking at collective liberation work within the scope of what brings me joy. So, mindfulness and and kind of like interpersonal practices.
Beautiful, thank you. Anybody move to go next?
Sure.
Go ahead.
Oh, sorry, go ahead.
Okay, I'll go and then I'll pass over to you. Hi, everyone. I'm Tess. My pronouns are she, her. I'm so excited to be here just to meet some current Barnard students, talk a little bit about this career pathway, in part because Barnard played such a huge role in shaping where I am today. So I'm just so excited to hear what you all are thinking about and to get to chat with you all. So I'm Tess. I am currently back in school to become a nurse midwife. And I graduated from Barnard in 2015. I'm now becoming a midwife with a concentration in gender and sexuality justice. And I took kind of a winding path to become a midwife through public health and health policy and health advocacy. Largely, I think because while I was at Barnard, I kind of went into Barnard bright-eyed, thinking I was going to 100% be an OBGYN. And Barnard kind of cracked the whole world open for me. It made me think really critically about the range of structures and systems of power that impact people's health, kind of all these structural forces that impact health, and also the way those same systems of power impact the health system and how people can access the health system and how the health system operates. And so I left Barnard with kind of big questions about where people could actually get sensitive, competent care, and how to combat all the forces that made that really hard to access. So I kind of weaved my way trying to answer that question through first working at community health centers, then working in health policy and advocacy, and then landed where I am today, which is that I really want to be a midwife who is providing that care directly to people. So that's where I'm at.
Awesome.
All right. It's so great to meet all of you virtually. I'm Joya Banerjee. I'm based in Washington, D.C. I graduated Barnard in 2004. So that makes me feel really old hearing you graduated, Tess, in 2015. Like both of you, Sabina and Tess, Barnard was so important in helping me end up where I am today, which is at CARE, which is a humanitarian organization. I'm on the gender justice team and I work on gender-based violence specifically. So what that means is we work in low and middle income countries, and I will work on helping survivors of sexual violence, on doing prevention of sexual violence, sometimes in humanitarian emergency settings, sometimes just in poor settings. And Barnard in 2004, actually the summer that I graduated, gave me a grant through, I think, the Office of Career Development to attend this conference in Australia. It was put on by Oxfam International, and it was a gathering of young people from all across the world. They picked 2 from every country who had identified a problem in their community that they wanted to solve. And it was like a 10-day project management workshop. And through that work, I met people from literally all over the world doing sexual and reproductive health and HIV/AIDS work. At Barnard, I was doing my thesis on the feminization of HIV. So it really aligned so well. And I was running a student club called Columbia Global Justice, who was across all of Columbia, including the grad schools. And it was a chapter of the Student Global AIDS Campaign, which was a radical activist group to get students involved in improving drug access to drugs that students had helped develop, or advocating for debt relief or treatment access, all kinds of things. But anyway, I took a long meandering path. All of it was focused on gender and global health and development, but I worked in private sector for a while, academia, NGOs. I ended up getting my Master of Science in Public Health. If I hadn't gone to that conference, I don't know what I would have done, but it definitely wouldn't have been this. So thank you. And
I'm happy to go next. Oh, Remi, do you want to go?
No, you're totally down. Go for it.
Okay.
I got to read my bio so I remember what I do.
That's fair. That's fair. Hi, everyone. My name is Natasha. You can also call me Natty. I graduated from Barnard in 2016. And so, yeah, it feels like it was yesterday, but also at the same time, I'm like, wow, I am now removed enough to like come back and have a conversation like this with you all, which feels really exciting and cool. I identify as queer, non-binary, Black, first generation Haitian American, and I am a psychotherapist in private practice as well, like Sabina. And I also work as a survivor healing and support specialist at the Me Too movement. And so I feel like, as all of you are saying, Barnard was extremely, extremely just a key factor in me getting to this work. I really identified with what you said, Tess. I came into Barnard like pre-med, like gonna be a neuroscience major. And then it was like, actually, I'm gonna be a women, gender, and sexuality studies major, and I'm gonna concentrate in race and ethnicity. And I'm gonna think more about like public health and just not necessarily seeing myself as becoming a doctor in that same way that I always thought would be the case. And so while at Barnard, I had the opportunity to be a peer educator with the Rape Crisis Center, and also co-coordinated Take Back the Night. So I feel like those were just really important avenues for me to deepen my passion for gender justice, healing justice, racial justice, and it all kind of eventually funneled me into this place where I realized I wanted to go into social work, and I wasn't sure what route necessarily. I wasn't sure if I wanted to go more clinical or more community organizing. I think community organizing was more familiar and comfortable for me. And when I started my social work program at Hunter, right after Barnard, I was like, oh, okay, I kind of like this clinical thing. I kind of like this interpersonal, more intimate work. And so that's how I got there. And after that, I worked at the LGBT Center in Manhattan. And then I went on to work at a group practice that centers working with people of color and queer and trans folks. And then after that, I started my private practice this year in May. So it's still new, still building, but that was my journey.
Thank you.
I think I read my profile, so I am pretty good. So I'm Remi, she, her, hers. I was not going into Barnard pre-med, but I was always going to be a psychologist. That was always been the goal. Parentified child, for those of you in the mental health field back there. So I was always going to be a therapist, kind of what was going to happen. But I was always interested in sort of like how folks end up incarcerated, and sort of like the difference between folks who get incarcerated and those that commit white collar crime. Now, I was very young and naive in having many of those thoughts, and which led me to work in prisons around the world. So I've worked in a couple of different countries for rehabilitation programs and diversion programs, some therapeutic jurisprudence and sort of like restorative justice work. But I really came to the conclusion that if you want to do really any work, it's working with the younger you can get, the better. That's sort of like the way that you can make the biggest impact on like an individual's life. And that led me to work with kids and teens in a lot of different settings. But right now, I work at a community mental health clinic in the South Bronx. I'm integrated into primary care. So I sit in I'm actually in a pediatrics office right now. And I do, so it's community-based mental health. So, when folks are coming for their primary care visits, A lot of times they're coming for like stomach aches and we're like, hey, that's anxiety. Maybe you should talk to a mental health professional. So I see a lot of those folks at short-term therapy, and then I've got private practice where I see folks longer term. And I think one of the most important things that I say, and the reason that I'm here, is that I'm the only Black clinician, and I'm in the South Bronx. So that's like weird that to be the only one. Openly queer, say it loud and proud, you know, from the treetops. Again, the only person that is queer in our team. And it's really important for me to say those things, and a doctor, right? I mean, you know, PhD, but doctor nonetheless. And to be able to be here and to say those things and to know how important it is to see yourself in somebody else and what you can be is why I stay here and why I work in a public hospital. And throughout the work that I've done, inevitably, Barnard has come up. My friends joke all the time. They say, what's that girls' school you went to? And I'm like, it's a women's college. All the time. Jokes abound. But we are everywhere. And that is why it was really important for me to come back and say that. Like, everywhere. I've been around the world and I've met random Barnard graduates who are doing absolutely incredible things. And, you know, sort of like regardless of whatever somebody's experience has been at Barnard in terms of race and gender and sexual orientation, because depending on the year that you went or graduated, and I was 08, things have changed a lot since us old folks were at school. And for better and for worse, I think. But regardless of all of that, it has taught me that because of who I am, I can do great things. And I don't think I would have learned that going anywhere else.
Thank you all so much for sharing kind of the origin stories. This is a great transition into the next question that I want to ask, which is about advocacy. I know that a lot of you have mentioned this as, you know, sort of part of your mission in the work that you do. And I'd love to hear your thoughts about the responsibility that health systems and healthcare practitioners have to advocate for patients, and, you know, the ways that you implement advocacy in the work that you do.
I look at it as I have many privileged identities. And so it is my job to use that as much as possible to help support folks that don't. And especially in healthcare, like, it is complicated and confusing at the best of times for the best of us. And especially because I work in the South Bronx, and with mental health, it's incredibly difficult to get quality care. It's incredibly difficult to find anybody that takes insurance. We can have conversations offline about that, but it's a broken mental health system. It's a broken health system in general. And so being able to advocate, especially for LGBTQ folks, especially, I like collect all of the LGBTQ folks. They all send them to me because I'm the only one. And so being able to ensure that, like, I tell all of the PCP, primary care providers, about how to change the pronouns and the names in our healthcare system. Like, those are very simple, small things that are easy to teach, that every doctor, every primary care provider should be doing. And to see the difference it makes for kids is like huge. So that's what I try and do on the daily for the docs here.
I think advocacy has been such a big part of my experience at Barnard and beyond. And it's really taken this journey of radical activism. So, like, chaining myself naked to all these people walking down Madison Avenue at the Republican National Convention to protest AIDS policies, to now very sedate and kind of mundane advocacy where I'm like helping pass laws at the state level in Nigeria, or getting more funding from international donors for work on gender-based violence. But I think that community organizing is something I still do in a really different way. I get to work with community health workers in really rural areas, and I focus on women's voice and leadership. So it can be things like having the community identify women and girls who are particularly vocal or show leadership traits or show potential in whatever way that they would define that, and then engage them in things like livelihood skills so they can do urban farming and sell their produce, or teaching them a vocational skill, or having them be a champion during like sex education with their peers, or helping pregnant girls get to health services, whatever it might be. But I think it's kind of a really enjoyable thing to work on decolonizing international development. My work is so much grassroots up. It's really hard to do sitting in DC, especially during COVID, not being able to travel. But all of our offices in 66 countries are staffed by local people in those countries, and everything kind of comes from those communities up. So yeah, that's how I do advocacy now. And stop there. Thanks.
I think I've also gotten to see through various positions advocacy at various levels and how different kind of spheres of influence can impact the health system. My career has been more US domestic based, but I've gotten to see how kind of a local level organizing, state level advocacy, and federal level policy can all impact what the patient experiences in when they come in to the exam room. And I think there's kind of really exciting advocacy happening at all those different levels. And I definitely felt like it was a really kind of a great part of this winding path of mine to get to experience all those different levels and see them all operate. I think for one example, I was working with a network of reproductive justice advocates across the US who are working to hold Catholic hospitals accountable because Catholic hospitals don't provide abortion or contraceptive care or gender affirming care. So working with this kind of grassroots organizing of reproductive justice advocates with the local Catholic hospitals in their area, to things like Medicaid policy reform so that people are covered throughout the first year after they give birth. So I think there are so many different ways that you can be involved in advocacy. And it was really exciting, and also kind of one of the I guess struggles in my career pathway is figuring out where in all those different areas that I could be engaged in advocacy, where I wanted to be in advocacy, and where I best fit in and could best contribute.
I think that there's so much like day-to-day advocacy that gets done through the work that I do with my clients. And in particular, I'm thinking about most of my clients identify as trans or non-binary, and there's just so much, there are obstacles every single step of the way throughout a person's day when they're having to not only do their day-to-day tasks, but also balance like trying to prove that their identity is valid to the people and systems and institutions around them. And so I've just found it to be really meaningful talking with clients about advocacy in all of these different spaces in their lives. For example, folks of mine who are students in colleges who are going into classrooms and being called the wrong name and being misgendered and not having their pronouns used, and thinking about how that can put someone in a state of mind where they feel like they have no control over the situation, and talking through, of course, how that makes them feel, but also highlighting there are ways we can go about this. And I want you to feel like you have the agency to try and advocate for yourself in this moment where there might be some other supports in place at your school that we can tap into, and kind of walking them through that process as many times as it takes for them to get to a point where they see themselves as able to do that for themselves. And then there's also day-to-day advocacy with, sometimes it's about self-advocacy, and sometimes it's like, oh no, give me your doctor's number and sign this consent form so I can talk to them so that we can have a conversation and I can get an understanding of XYZ issues that you're having when you go to this office. So yeah, I have always thought about advocacy as big scale systematic changes, and through my work have really been able to see also how it really is like day-to-day actions.
Yeah, my mind is swimming with all these thoughts now. I think it can be very debilitating to think about all the things that there are to do and that need to get done. And I guess what I would say is, when I think about liberation or solidarity, Joya mentioned decolonizing work, I think about like how we can be in relationship and get away from feeling like we're that important, like to save people or be the one, and to be in more in community and to find our own little piece of the pie that we can kind of work on that brings us joy or lights us up or feels meaningful. So whatever it is, it's going to look different for each of us. And I think that we all, just making assumptions about us Barnard students, are doing it in some way, whether that's with friends or at the college level. I was remembering as people were talking about Barnard that in 2000, and like this again, now I feel like the elder, I was part of a club that we created the first gender exploration day, and it was a different time. And we brought Kate Morenstein to perform and to speak, and it was all different, and that was transformative, and it planted seeds, and now my work looks different, but I feel like wherever it is that you find yourself, that you can make change. You don't have to become a gender justice advocate and have a title to do that. It can be, if you're an engineer, you can do it in the place where you work, or in looking at the insurance coverage for trans and gender non-binary people, or for mental health within the place you work. It really could be absolutely anywhere, and it can be meaningful.
Thank you all so much. And speaking of that, sort of like the influence of the times and the sort of the context that we're talking about, I alluded at the beginning of the conversation to, the fact that we're living in what feel like really strange and hostile times politically for many, many, many of the folks in our communities. And I'd love to get your perspectives on, for example, the situation in many states where legislatures are passing laws to limit access to gender affirming care, especially for trans youth. What are the misconceptions? What are the things that are being missed in these political conversations that you as practitioners would like to see? And what are the ways in which, you would encourage your colleagues in healthcare spaces to advocate for trans folks, non-binary folks who are, who are being, really, really damaged by these political conversations?
A couple years ago, I was participating in a training program with the Gender and Family Project. That is like a department within the Ackerman Institute for the Family, which is like a family therapy organization. And I think we focused specifically on family therapy in the context of a family that has a child that is coming out as trans or gender expansive, or really just like exploring gender. And I think my main takeaway from that experience and getting to work with all of the families is how both like authorities within a family and authorities in terms of like government really seem to have this misconception that children can't know things about themselves and that young people can't know things about themselves. And it's just not true. It's not true. I feel like youth prove this to us time and time again. And I feel like the most like healing work I was able to do with these families was when we would discuss just how getting to a place where you can accept and support your child is really protecting them from so much. Like that is going to make all the difference to them when they're hearing you call them by their name, using their pronouns, at least engaging in conversations with them about gender affirming care that they might be bringing up to you or you might be bringing up to them. When they see that you are seeing them as valid and treating their identities as valid, that protects them from so much like distress and mental anguish and all of the impacts that that can have on a person's life. And I mean, when we look at rates of suicide amongst trans and gender expansive youth, they're extremely high. And I think that a huge way to combat that is through education with parents, legislators, et cetera, around like what exactly is the process of like development of gender identity, and like how that's a process we all go through. It just might, you know, have different results for each of us. And just really trying to, it's unfortunate that there has to be an effort made to humanize trans and gender expansive folks and young people, but I do feel like that is oftentimes what the work feels like.
I think working in healthcare, it's clear how those can forces the health system is so built in a way that centers whiteness and cisness and straightness, and how that really permeates every aspect of the health system and all the providers who exist within the health system. And so to be a queer midwife, to be queer providers who are trying to create something new, we're really working against a long history that centers whiteness, that centers cisness, that centers straightness. And that's clear even, you know, even currently as a student midwife who's learning from kind of an older guard of midwives. You know, to me, my goals as a midwife is to support queer family building, to preserve fertility for people who are transitioning, who want to preserve fertility, to provide abortion care, to provide contraception care to transmasculine people who want it, to provide, those are all equally a part of midwifery to me as being present for a birth. And so I think that's that, and some of my fellow peers, that's what we bring into this and where we're trying to bring the profession of midwifery, but particularly in a part of healthcare that's so heteronormative and focused on womanhood. I think there's a lot of work to do to make it really, to create that new vision.
One of the things I've obnoxiously done forever is look at policies or look at like a handbook that tells you the rules and then find out exactly what I'm able to do and not to do. And I've found that oftentimes we tend to ask the question and hope to get permission, but often the answer is already in the policies. And I say that because, for instance, at the hospital I work at, we have, you know, lots of folks have preferred names for lots of different reasons. And I had a student that I was working with who wanted to change their name and have their preferred name on their ID. And it's really awful as somebody who's Nigerian with 3,000 names. It's really difficult when people call you one name and you use another name and it doesn't line up with any of the legal resources or with any of the documentation. So people have a lot of trouble finding me in the systems. At any rate, they wanted to change their name. And there is a document, there's a policy for the hospital that says, this is how you change your name. This is what the policy says. It's here in writing, and it's updated as of 2022. So they have to do the thing that is there. They may not like it. They might not know what it is. And let me tell you how many phone calls I made to tell them that this is literally a thing that you're supposed to do based on your policy. But I think that is also one of the ways that we can advocate for folks and then I sent that policy to all of my coworkers and said, hey, change your name, because the system that doesn't know how to utilize their own policy. And to take the burden off of folks who need it to happen, so that the system sort of like gets a test trial with other folks who have much lower stakes in the game. And I think that helping folks find the loopholes for them to get what they need on an individual basis is something that I'm obnoxious about, and I sort of like doing. I like showing that you can actually use policies that are already in existence to get what you need. And I often think that's a lot faster. I'm not going to go to DC. I'm not going to do big policy stuff because it's soul crushing. So I think that being able to do it on the individual level with things that already are in existence is where I like really try to work. And if it's not there, if there isn't a policy that says you can't do something, then that does mean oftentimes that you can. And so you're just going to have to be the first. And I work with a lot of folks to ensure that they are badasses and are the first.
Remi, the word that's coming to mind as you're talking is infiltrator, and I love it. One of the things I would say about like healthcare policy in working for trans liberation, because that's the way I think about it, is to approach it with humility and realize that there's a lot of gatekeeping, and there are things that are in the system right now that I work with, and I do writing letters, for people who want gender affirming surgeries and healthcare, and also realizing that we're gatekeepers, and that working with my patients, or to think about how they want their letter written, right? Not how I think I should write it. So they can decide, do they want one where there's a high level of medical authority coming from a mental healthcare practitioner, or do they want one that's focusing on body sovereignty, and that they have ability to make an informed choice, or both? And because it depends on what they think is going to work for them, and what's going to, what's the priority for that individual person. And because there are times where I know there's something I'm going to do that's going to make it more difficult for me, but it's going to be difficult either way. So I feel like I get to choose. And I just was going to add to, Tess, what you were sharing about your work and being a queer person and navigating having a child. I will tell you, there are a lot of barriers, and it is so messed up how it's not even womanhood that it prioritizes. It really does prioritize straight men being part of the process, and hetero couples, but men, at the end of the day, men are still there at the center. And I have like lots of intricate stories of how I tried to work that system to get what I wanted my way.
They do sound like very good stories. So I want to ask one more question, and then open it up to attendees to ask their questions as well. But on behalf of the attendees here, I know that some of these are folks who are thinking about careers in healthcare, and I know from my experience as a health professions advisor, and as a patient, and as the family member of people who work in health professions, that things are rough right now. Like, I mean, it's never easy, but health professions and public health policy is a messy industry to consider going into. And so I'd love to hear your advice. If there's a person in the digital room who is thinking about a career kind of along the same lines as yours, as an undergraduate, what advice would you give them? Remi, you don't have to go first.
I mean, I will now, though. like my situation's like a little weird because I really was always going to be a psychologist, and I do think that it would have been nice to have had somebody have a conversation with me along the way about why. Like what you decide now, as evidenced by all of us here, is literally not the thing that you're going to be doing in like 5 or 10 years. So I think the thing that I found the most important, and again, sort of like changes, is to like figure out who you are and what is important to you. Because like if you're going to go to med school, you're the one who's going to have to deal with it. So you have to find your own intrinsic reasons for what it is that you want to do. And a lot of that also, especially for healthcare and helping professions, comes from like that self-exploration. So yeah, we all want to save the world and all that kind of stuff, but I think that we do have our own individual reasons for doing stuff. And although I've done a lot of different things to get where I am now, the more important thing is that I'm proud of who I am now. And that allows me to continue to do the work in healthcare that is really difficult to do. You know, like I'm not paid very well, and it's a very hard job and a lot of high risk, really awful things I hear all day, every day. But at the end of the day, the thing that makes me the most proud and why I keep doing it and why I'll choose my next jobs, even though they might not, I could never have imagined those would be the things that I would have done when I could never have told you that I would be here when I graduated, ever. But I'm proud of who I am as a Black queer woman, first generation, doing things for my community. And that is what helps guide me in each of the different things that I do. And I think if you can figure out that, then sort of like the in-between bits and pieces of like the different jobs that you'll do matter less, because each of them are sort of like stepping stones to get you to be the person that you want to be.
That's hard to follow because it's so beautifully said. I just really, really love that. And it really, really resonates. I think one thing I would add is that there are so many different ways to be involved, to have a career in healthcare. And I think this panel actually does a really great job of showing that. And for me, you know, I don't think I had any idea that while I was at Barnard that being a midwife was a real job that I could have. You know, I think I was like reading sociological articles about the benefits of midwifery, but I didn't know anyone who was a midwife. I didn't see that as a pathway that could exist for me. And so I think it is important to remember that there's not just one way into being part of the healthcare profession. There are so many different ways. And I think something that has been really helpful to me, and this is similar to what Remi was saying, is that it was very useful for me to think not just about what I was good at, but what I really got meaning and joy out of doing. There are a lot of things that I could be good at doing, but I found that where I was best able to contribute and to kind of shift the system and make change was where I was also getting the most meaning and the most joy out of the work that I was doing.
I think something that really, oh, you want to go? No, okay, I'll pass it to you after. But I think that's something that was really instrumental during my time at Barnard and only continued to be instrumental as I went on into my career, was just me personally having to get over the fear of like approaching people that I think are really cool and are doing things that I want to be doing, and like asking them questions and like, you know, putting myself in the position of a mentee if they'll have me. I think that was something I was always really nervous about doing. And at Barnard, like started to encourage myself to try to get over that fear. And as I've gone on in my career and have, you know, come across a bunch of other mental health professionals and health professionals in general that are doing their work in a way that I really admire, it's just been so like empowering. And yeah, just also the relationships that I've been able to build by just taking that step and reaching out and being like, hey, I think what you do is cool, let's talk. So that's definitely something I would 100% encourage people to do.
Yeah, I think personal passion is definitely something that has propelled me through my career. Times when I've done jobs that I wasn't passionate about, I just wasn't ever good at them. And for my career, it's definitely pretty low paying compared to other careers. So I feel like without that passion, it would be really hard to keep on going. So I do this work because I'm a survivor of sexual violence myself. And I feel like women in developing countries don't get the kind of, well, I didn't get care, but they don't get care, and there's even less access to it. So personally, I'm really committed to building up systems to ensure sexual violence survivors get mental health support, medical care, economic support, etc. I think my advice would be, I know it's a rat race when you're in college. It was when I was there, and from my nieces and nephews, I know it's even harder now. It's like you're supposed to get an unpaid internship when you're a toddler. So I think my advice would actually be chill out and relax and enjoy your youth. You can do so many different jobs, and it might take you 10 years to figure out what you really love. So experiment with things that intrigue you. Even if you have imposter syndrome, which I think we all have, be open to learning and be really proactive about asking mentors for their advice. I think network like crazy, because almost all my jobs I got through having a connection within an organization or a company, and then like having them able to flag my application, except for maybe two. So unfortunately that is, a reality. And yeah, I don't know. I think don't pigeon yourself into something now. Like, you might think you want to do something. I thought I really wanted to do very research heavy HIV focused work. And then, I mean, I was doing all prevention work, and then when treatment became globally available at a much higher level, the funding for HIV prevention just evaporated. And it was after the financial crisis. So if you pigeonhole yourself into something, global circumstances or your interests might change. So I think it's important to develop a really broad skill set. Barnard definitely helps you become a really good writer, but that has definitely been the most important skill for me that has taken me throughout my career. Thanks.
I'll just say briefly, because I want to hear from the students as well. Embrace the unknown, dreaming and in, both, our sleeping and waking lives. I think sometimes waking life is overrated when we're not dreaming in it. And you don't have to have a straight and narrow path. And this is the only life you get to live. So do it the way you want to do it.
Wise words, definitely agree. And I want to open it up for attendees to ask questions. You're welcome to raise a hand, ask with your microphone, put things in the chat. Jen.
Hi, I'm a junior here, and I'm also a prospective midwifery student. And part of my interest in midwifery came from learning about the Black roots of midwifery and really connecting with that. And I just have a question for all of you. How do you manage both professionally and personally to do the liberation work while at the same time you're working within or learning within institutions that are still deeply tied to upholding white supremacy? Like, how do you manage with that and continue to do the work that you do?
Didn't give you an easy one. Sorry, y'all.
So I think I'm the oldest member of the group. It's taken a long time for me to find something that looks like balance. And I think finding a meaningful community for yourself is really, really important. During the pandemic, I became more involved with a mindfulness group through Reverend Angel Kyoto Williams, who is someone that some of you might like. She talks about radical liberation and race. Just finding your own, like, we're always practicing something. So it's like finding your own personal practice and connection, because we need connection. We can't do this alone and have joy.
First of all, I just want to say I'm so excited to hear that you're thinking about midwifery, and I would be happy to chat about it more. I think honestly, this is a question that I sit with all the time, particularly as a white midwife. This is something that I sit with every day and certainly do not feel like I have an answer to. I think some of the things that have been useful in kind of grappling with that question have been finding community, kind of like Sabina said, finding other people who are asking those same questions about how to work within an institution that is rooted in colonialism and white supremacy, finding people who share that same question, being able to have them as kind of partners and co-conspirators alongside me has been really, really useful. And then I think especially as a student, finding other ways to build the type of system, build the type of world that I want to see outside of class has been really useful. So for example, I'm working with a group of midwives of color in Brooklyn who are trying to create the first nonprofit birth center in Brooklyn. Which hopefully will happen. I'll keep you all posted. But so finding other ways to kind of recognizing that I'm working within a system that has all kinds of barriers and structures, and also outside of that, trying to create new systems. But again, happy to talk more, and I certainly don't have an answer to your question.
Erin, go ahead.
Hi, I'm also a student who's hoping to go into midwifery. And I was just wondering kind of how you decided on that as a career path versus kind of other ways to be involved in like reproductive health care and birth work. And then just kind of any advice you have for navigating, because I've kind of been struggling with, there's like not a lot of like resources or information about like what, to get ready to apply to midwifery school and things like that.
Yay, this is so exciting to me, because as I said, when I was at Barnard, I didn't even know that being a midwife was a real job, as opposed to just kind of a beautiful imaginary thing that existed somewhere far away. So first of all, I really mean it. I am happy to talk. I'll share my email and happy to talk one-on-one more. I will say that in my small class of 15 midwives, there are 3 Barnard students. So it's a pretty amazing how many of this there are. I chose midwifery after kind of a winding path, initially thinking I was going to be an OBGYN, then working in community health center, more in a primary care setting, and then working in health policy. But I think I had the same feeling that it was hard to kind of figure out how to get into midwifery, and hard to find the resources, hard to find the experience. I became a doula, which was a really useful way of kind of getting exposure to where midwives were working, the type of thing you might see as a midwife. So I would definitely recommend that. It's something you could even do, even if you can't start practicing as a doula while you're in school. You could definitely do the training while you're in school, and even just the like 2-day training is a great way to start thinking about midwifery. So I would definitely recommend that. In New York in particular, Ancient Song Doula does amazing trainings that have a real reproductive justice lens. So I would suggest that as one way. But again, really, please reach out to me. I would be really excited to talk more.
Happy to talk doula training too.
Anna, you have a question?
Yes, I do. So I'm thinking about becoming a psychotherapist, but I'm a history major right now, and I'm interested in kind of, I guess, our mental health history as a country. We're in like kind of an age where like mental health is maybe a little bit less stigmatized, like very people are very open about going to therapy and pretty open about just being open with their peers, and I'm just wondering about, like, as mental health practitioners, when did you like see this shift in your career span, And also, like, how do you reconcile with the history of mental health in this country? Like, is there something particular about American mental health? You know, I'm just so interested in hearing like what you have to say about that whole intersection.
Great question. I think I'll tackle it from sort of where I work now, which I work with a lot of immigrant families, in particular, there's a lot of West African families I work with. And I think the one way that I sort of like try and reconcile our history by ours, I mean, definitely the white men that we learn about in school, and that we're supposed to like use as therapists or as psychologists at any rate. I think that understanding where folks are coming from and the propensity for like Americans to pathologize a lot of stuff that's really totally normal is sort of like how I try to balance that, and really incorporating lots of like collateral, so like family and community members and like religious folks, if that's who's important to the family. I think that the way that we can sort of like outweigh sort of the really negative pathology from like the white colonial history of mental health is to use our communities to give a little bit of a counterbalance or a little bit more voice. So you know, the kid that is rebellious might not actually be, it might have to do with things at home, or it might have to do with the way that their family looks at things, or it might have to do with the family at home that, you know, mental health wasn't a priority in any kind of sense of way. So being able to give a kid a voice to do that can in and of itself be powerful. That sort of answer, yeah.
And
Go ahead, Sabina.
I love your question, and I would love to read anything you write about the history of mental health in the U.S. I think that we are in a unique moment that is particularly sick, like our society is sick, and that therapy is the way we have most available. It's not the only way, and that it's more or less stigmatized depending on your community and where you kind of exist, and making it more accessible is so important. Yeah, I know we're running out of time, but that's what I would say about the modern moment, is that we're really sick everywhere.
Thank you all so much. I want to let our panelists go on to the rest of their days. Thank you all for your openness and your generosity in sharing with us today. It has been a privilege and a joy to have this conversation. Such a wonderful experience to meet y'all. And we just thank you so much for being here with us today. Thanks, students, as well, for your fantastic questions. And everybody have a great afternoon. Bye.